I'm speaking to you from the southern part of the country, Blue Nile, where we are facing a cholera outbreak at the moment. But at a large level, Sudan as a whole is facing multiple compounding crises right now, both in terms of conflict, disease, and disaster. And that's really a perfect setting for an outbreak like cholera. In particular, this country has been in serious conflict since April 2023, which has caused the breakdown of health services as well as sanitation across the country. So, as a result of that, more than 11 million people have been displaced as a result of this crisis. And this means people are forced into overcrowded gathering sites that often have really poor sanitation services and perhaps the lack of clean water. This may lead to open defecation in the river or in water sources, and that contaminates the water that people use for drinking, cooking, cleaning, and ultimately this can lead to a really fast spread of cholera. I just highlight this is also the rainy season in many parts of Sudan, including here in Blue Nile, and that often leads to flooding, which can cause an increase in the spread of this disease, particularly where sanitation is really bad. For example, yesterday I visited a gathering site here in Blue Nile, and the community leader pointed out the latrines and he said that they were overflowing because of the recent rains. And that site had already had one outbreak of cholera, and the likelihood of a repeat incidence is higher as a result. Now, the Ministry of Health, along with health actors like Medair and WHO, as well as UNICEF, have been reacting well to this in coordination to bring vaccines as much as possible to these areas of outbreak. But Sudan is just a geographically huge country, and there are just so many inaccessible areas due to conflict or flooding, seasonal access issues. So quite often these vaccines are only able to be given in hotspot areas of accessible regions of the country. And so this shows in a huge gap in vaccine availability.
So is this outbreak of cholera effectively a problem right across the country? Like, who is being affected by this? What are the numbers and what does this mean for people's lives?
It is prevalent now in 17 out of the 18 states here in Sudan. The capital, Khartoum, which has been particularly conflict affected in the past 2 years, has been a real serious center of the outbreak, but many other states have been affected as well. Like I said, it's often in crowded gathering sites where sanitation is poor, but we're hearing that there's many areas that you would not necessarily expect to see outbreaks where it's also cropping up. So some of the more stable areas, in fact, have also had outbreaks. What this means is that just in 2025, we've had 50,000 confirmed cases, and in the past year, more like 100,000. The WHO sets an emergency threshold for case fatality rate, and that threshold is about 1%. We're seeing that many areas of the country have case fatality rates that really exceed that level. They're up to 5 and even higher, 5% rate and even higher.
And that must be really distressing for the families involved. What does that mean for your efforts and those that you're working with to have that level of sickness and rate of fatality? That must be challenging to deal with.
Yeah, I think it in some ways gets subsumed by the larger crisis here as well. We're dealing with a breakdown of health services, of water services. Schooling has been discontinued since the outbreak of the conflict. We see a lot of people in our own teams are dealing with mental health issues as their families have been directly impacted both by this conflict, but also by cholera. So we're striving to make sure that we give support to our teams, that we give them the tools to understand how the crisis and cholera is impacting them so that they're able to continue services and to continue serving people.
And you've mentioned that you've been able to give vaccinations in a few hotspot areas. Beyond that, are there any signs of hope in the midst of all this?
There is. We are seeing growing stability in many areas of Sudan. There are certainly areas where there's massive deterioration in security and access. But for example, in Khartoum, where the water systems were heavily damaged as a result of the conflict, there was quite a large outbreak there. Health actors, in coordination with the Ministry of Health, have been able to really respond effectively there. So for Medair in particular, I can mostly speak to our services, but we operate health clinics and water services. And in particular, in Khartoum, we were able to distribute hygiene kits to 2,000 households in a particular hotspot. This kit included water containers, water purification tablets, and soap. We did a similar distribution in White Nile State last year, where we reached more than 30,000 people with cholera prevention messages. So, really, what we're trying to do is both prevent and respond. We bring on extra training for our health staff so that they are prepared and responding to the crisis effectively. So they're better able to identify, manage, and stabilize patients. Then we've brought on rapid response teams in coordination with the Ministry of Health and other actors. And these teams are deployed for investigation of cases, suspected cases, and sample collection and isolation of the suspect case. Maybe most importantly is just sensitizing the communities. I mean, if I weren't working in this, I wouldn't know the early signs of cholera. So what we've done is we've brought on and trained additional community health workers. These people do community outreach to the communities, and they share messages on how to prevent cholera through proper hygiene and sanitation, and how to recognize the early signs of cholera so people can seek treatment as quickly as possible. We've also been able to set up oral rehydration points in Khartoum to treat and stabilize patients. Now, we operate basic health facilities, so we'll treat patients on site, and then we'll arrange transportation for severely ill patients to a dedicated inpatient cholera treatment center.
So clearly a lot of work to be done and a lot of diverse work being done by yourselves, Medair, in Sudan and your partners who you work with as well. Rachel Hirons, the country director for Medair in Sudan, thank you ever so much for your time.
Thank you, David.